NCSBN website, the National Council of State Boards of Nursing. Those are the people who are the writers of the NCLEX. Okay, and the writers of the NCLEX create the test plan as well. And I am a firm believer that if you want to learn how to pass a test, you have to start with the publications that the test creators make for you to be able to study it. Okay, so I like to always start here. What is the test? What's it all about? How do you pass it? Those are the questions we're going to start with. All right. So if you get to this page and download this publication, it will take you to another screen here where the PDF will come up. Okay. It's 56 pages of just description about the test. But I'm going to point out to you some very important things that I believe you must know moving forward. Here's that word clinical judgment, all right? It's part of the new test plan structure. This is the 2023 NCLEX test plan, meaning Next Gen, all right, is all included in this new test plan. All right, the NCLEX test plan structure is basically 8 categories. Okay, and the content described on these 8 categories are here between pages 7, all right, and 14. And I'll point out the categories by reading them aloud for you. And then I'm going to click on one of them and we're going to kind of break down what we're looking at. All right. I don't have enough time to really spend on all of them, but I just want to make sure that you know the categories you will be graded upon. Okay. So safe and effective environment, care and environment. Okay. Coordinated care, that is unique to the PN test. For the RN test, this is management of care. So you have to be careful if you get your hands on top of or get your hands on a group of practice questions and you notice management of care at the top. Those questions are not for you. Okay. Management of care. Now, safe and effective care environment questions, those are perfectly fine for you to share those with the RNs when you're practicing, because they're the same. All right. But coordinated care is different from management of care. There are some similarities among those questions, but there are some key differences. So there are only 2 of the 8 sessions that are different for the PNs and RNs. So I want to point those out to you. Safety and infection control, both the RNs and the PNs have those questions, therefore, and they are the same. Therefore, you should be able to take those practice questions right out of the RN texts if you wish, okay, because they're the same. Health promotion and maintenance, the same. Psychosocial integrity, the same. Physiologic integrity includes these additional 4 categories, okay? So physiological integrity includes basic care and comfort, same as the RNs. Pharmacological therapies. Now, these are slightly different because RNs have that additional parenteral, okay? Pharmacological and parenteral therapies. And parenteral means through the IV, okay? So intravenous administration of medications. Okay, so that's something you don't have to really worry about, or IV meds, having to mix them, having to administer them. Just no IV meds for you to worry about at all. It's mostly going to be PO, transdermal, and other routes of entry that don't include IV. Okay, so pharmacological therapies. Then reduction of risk potential. That's a big category that we're going to talk about. And then finally, physiological adaptation. Okay, so those are the 8 categories that matter. They really matter in terms of what you're being graded on. Now that we pointed those out, I'm just going to click on one of them. This, when I clicked on it in the table of contents, it brought me right to page 9 here, health promotion and maintenance. Now, health promotion and maintenance. Okay, I saw we lost Benta, but she is back on here. Okay, so health promotion and maintenance, that's just one of the categories that you're going to see, all right? And health promotion and maintenance. I just want to, for this one section, I just want to read off some of the concepts that you would see as related activities when we're talking about health promotion and maintenance. In other words, what do health promotion and maintenance questions ask of you on the NCLEX? What do they want to know? All right, so here's some bullet points. Provide care that meets the needs of the newborn less than 1 month old through the infant or toddler client through 2 years. Okay, provide care that meets the needs of the preschool age and adolescent child ages 3 through 17. Okay, provides care that meets the needs of an adult client ages 18 through 64. And then, no surprise here, provide care that meets the needs of the adult client ages 65 and over. So what is this telling you? This is where you're going to get those developmental questions. These are where you're going to get those questions about the stages of development and where that person might be among their stages of development. When you are doing what with health promotion, you're usually educating them. So it's great for discharge education. Maybe there's a procedure happening and you're going to do some education to your patient or reinforce the education that your RN has set up. All right, so that's just basically a way of thinking about how you're going to break down in your mind what each of the questions or 8 sections are going to be asking you about. Why do I care about this, and why am I spending so much time about this? Because in order to pass the NCLEX, you have to pass all 8 of these categories above the passing level. Not near the passing level or below the passing level. They all have to be passed above the passing level. And if you're not successful on the NCLEX, they're just going to repeat to you. They are going to tell you what you got wrong. They're going to repeat to you this same list. I'll show you in a moment what the candidate report looks like when a person doesn't pass and they get the answers back. Well, not the answers back. They get back it's kind of like a grade report that's telling them where they were above or below the passing level. They also give you a bulleted list of concepts that you could have seen, and most people don't realize that it's just a repeat of what you see right here in the test plan before you even take the test. All right, so in other words, you're going back to the drawing board and you're going to start studying all over again, because you could get a whole completely different list of questions. All right, so we are looking at the publication here, and I think that's about all I want to show you, because I'm going to make our way back to the slide so that I can show you how these test plan issues kind of come up later on. All right, so a little bit more specification on the design of the test plan. It is a 5-hour plan now for both. Well, it always was for both the RN and the PN. And I use this third category over here to talk about Next Generation NCLEX or NGN, because now they've been kind of merged into one set of design specifications instead of 2 different sets of design specifications. Okay, so now all tests, they're both still variable length computer adapted technology. That's what CAT stands for. And variable length means one person may have the minimum number of questions, which is 85, all right, 70 scored questions plus 15 unscored pretest items that are just kind of basically sample questions that we're trying out to see if in future NCLEXs we might use those questions. So they're called pretest items or unscored questions, okay? So 70 plus those 15 give you 85 total questions as an absolute minimum number of questions you could get, whereas the maximum number would be 150 now, okay? They used to be 145, 156, they kind of had a little weird upper limit, but now we're looking at 150 questions as your maximum number of questions. And the reason why it's variable length is because the computer is adapting according to your responses. So let me tell you a little bit about computer adaptation. For every correct question that you get on the NCLEX, for every correct question, you're going to get that next question to be a little bit harder or of similar difficulty. All right, for every incorrect question, however, the next question will be of similar or easier difficulty. All right. It's going to be an easier question. Why? Because the NCLEX needs to give you as many opportunities to prove to it that you know what you're doing. All right. But it's only going to give you 150 total items for you to learn that, and for the algorithm to learn that about you. All right. You get 150 at the max number of opportunities to show what you know. Okay. So you want to get as many correct answers as possible. Absolutely. But when you score one wrong, that's okay. You can always work your way back up in the algorithm to demonstrate to the algorithm what you know. Some questions are harder than others. Some questions are easy, entry-level concepts, definitions that are considered less difficult. Some questions are multifaceted, very critical in the nature of the question, and really can tell the algorithm a lot about how safe you are, okay? Because that's what this test is about. How safe are you as a nurse? If a patient is going bad and they're heading in a direction to be in a diabetic coma, or maybe they're heading towards seizures, or they're at a high risk for falls, are you the nurse who can recognize that and prevent the worst case scenario happening to your patients? Okay, and I'm going to coach you more on what that looks like, right? Because the NCLEX is a crisis test. It's trying to throw all of these potential crisis scenarios at you, and they want to know how you're going to catch them, how you're going to respond to them, or even if you recognize that there's a problem happening in the first place. Okay, so variable length computer adapted test with pass-fail rules that are super complicated. So we're not going to spend too much time on them, but I will tell you this. In order to pass the NCLEX-RN, though the test taker had to score about 51% of their questions correct at a minimum. Okay. So in other words, we started understanding that for you to pass, for the computer to shut off, you had to, as an RN, score 51% of your questions correctly. As soon as you get to the 51% mark, it shuts off. Okay. So that's not a lot. Okay, that is not so bad. For the PN, it's a little higher, 9 points higher at 60% of the questions that you are presented with. You have to score correctly, and then that computer will shut off. See, it's not like nursing school where you needed 75% minimums and 85% minimums, that kind of thing. You are fine with a 60% minimum. So when you're studying, doesn't that change a little bit how you focus your studies? You don't have to be perfect, but you do need to understand a lot of concepts, okay? That's where the 60% is going to come in. Do you know 60% of each of the 8 categories? If so, you get to pass the NCLEX, okay? So keep that in mind. The test logics are going to remain about the same, even though everything else about the test is pretty much the same. All right. These test logics will be a little bit different. It'll be tougher to pass the NCLEX if you are a PN. It's just the way it is. And I do believe it has to do with the fact that PNs have to have all the knowledge of the RN. And trust me, you guys tend to be very bright in terms of what you know. I love working with PNs, and both in this setting, in coaching for the NCLEX, and in the real world setting, because PNs have to know everything. And this is proof that you guys have to know more than RNs. And we're going to go through some practice questions, and you're going to notice, well, I noticed this because I work with both types of students. I noticed that you guys tend to be much higher on your foundational knowledge about your patients. And it has a lot to do with probably spending more face time with your patients. Okay, so with that said, there we are with what's common about the tests. Now, what's new is the case studies. All right, these situational case studies where you have an unfolding scenario happening in front of you. Out of 6 questions, all right, you have, well, there are going to be 6 questions for each case study. Each case study has 6 questions. You might see 3 case studies. You will see 3 case studies. Okay, you may see more, all right, but you will see a minimum of 3 case studies, each having 6 practice or 6 questions with them each. I'm going to show you the method to the madness behind the 1 through 6 questions. Each one of them have a similar structure. So I'm going to show you how that goes. That way, when you see those case studies, and let me tell you, people say they love the case studies. They make sense. They look like real life. And it's just a new way to take the test. The new version is fair and it plays better into your knowledge. So I wouldn't worry. I feel like if you study right and make sure that you are covering all the different 8 areas, you will do wonderfully. Okay. Not worried about you at all. And now you're connected to me. And I believe in my coaching. Okay. I believe I've put together a wonderful package here that is getting people through to passing the NCLEX. Okay. And we've been doing this now for about 7 months with the brand new curriculum, and it's working beautifully. All right. So all you have to do is do your part and put in the time. All right. So with about 150 questions max, all right, a lot of people are doing it in far less, okay, because they get the system and it's working for them, okay? All right, so there's just some more details that if you're interested in, you can listen to the video and it will take you through there. And there's a summary slide that kind of gives you some of the details. Just know that from the summary slide, I just want you to know that the very first 70 questions, let me go back here. The first 70 graded questions are going to include all 3 of the next generation case studies. All right, because there's no adaptation. The computer doesn't do the thing where if you score something wrong, they give you an easier one. If you score something right, they give you a harder one. It's not going to play that game on the first 70. I'm sorry, they're not going to do that during a case study. All right, they're not going to do that during a case study. So the case studies have to show up in the first 70 graded questions so they can get them out of the way. All right, so that the adaptation can continue for you at the end of your test, because that's where you're going to need the most adaptation and help. All right, so I hope I didn't mix you up there. The first 70 questions will be adapted. All right, but case studies are not adapted. So for that reason, you have to get those case studies out of the way in the first 70 questions. Okay, you want that because you want adaptability. You want that. All right, so that's, for more on that, check out the video. Okay, so we talked already about the 8 sessions. These questions here have a what we call word cloud. Okay, word cloud. And these word clouds, the bigger the word, the more important that concept is, or the more it shows up, that word, when you're doing these kinds of questions. Now I'm looking at a management of care word cloud, but that's not relevant for you guys. You guys are doing coordinated care. Okay, in coordinated care, all right, where you're going to see questions around clinical data. Okay, transferring your client. A lot of client information comes up in the coordinated care process. You're working with assistive devices. All right, here's a big word: recognize. Okay, coordinated care is about recognizing a problem that's showing up in your client and then providing monitoring. Okay, working with the team to provide assistance to the client using clinical data. All right, and you're working with an interdisciplinary team, keeping that patient's confidentiality. All right, it could be transferring the patient or receiving a patient who's transferred from another unit. All right, so lots of good stuff is here. Security, patient's rights. All right, advanced directives could be in here. Coordinated care is just you being able to notice that your patient that you have in your care is decompensating, and now you got to get them back out to the team. And that happens a lot with the PN questions. That's where I believe that real 60% comes in for you guys, because you have to know all that the RN knows, but you're limited in your scope. You can't always just get a bolus going for them because you see that their blood pressure is dropping. But seeing that their blood pressure is dropping is triggering you as a nurse to coordinate the next proper step for them, which is what you know to be a bolus, but you can't give it. All right, so you have to notify the RN, who is within their scope of practice, able to start the bolus, even without the MD or the healthcare provider. All right, so knowing who to delegate over to is very important in coordinated care questions. So we'll see some practice versions of that, and you'll get to see why the PN role is so unique and special to the team. Okay, because you guys recognize things and then you get that patient where they need to be. All right, safety and infection control. You see the terms here, right? Safety, universal, standard precautions, barrier methods. Okay. Safety is not just about PPE, it's also about patient ambulation and all that stuff there. Okay. Health promotion and maintenance. Okay, remember when we looked at it before, they were talking about the different stages of development. So you got your adolescence, your newborn. We have those different parts of childbirth, right? The antepartum, postpartum phase. A lot of those are considered health promotion and maintenance problems. If they actually give you a question that mentions the patient's stage of development in the question stem, it's probably a health promotion and maintenance question. And guys, you'd be surprised how many people aren't able to pass the health promotion and maintenance. You would think it's just so basic because so little of your energy in your nursing schools are spent in health promotion classes. Well, not at the new university where I'm working. There are 2 health promotion classes for all of the nursing students there. So it's gaining more importance, but don't sell it short. I mean, those kinds of questions are definitely showing up and you have to pass them. Okay, psychosocial integrity. All right, so where you're going to get into your psychological abuse, issues around substance abuse, sensory or perception issues like, mental health disorders, stressors, how people respond to toxicities, withdrawals, dependencies, okay, therapeutic communication, all that stuff comes into psychosocial integrity. All right, we have basic care and comfort here, right? This is bladder interventions. Bladder comes up a lot here. All right, a lot of the care, a lot of the therapies that are connected to assisting the patients or providing assistive measures, basic care and comfort. It's really a lot of the non-pharmacological things that you do with your patient, and a lot of them tend to have to do with toileting. Okay, basic care and comfort, but also kind of helping them when they're cold, knowing that your patient who is hyperthyroid, might need the room temperature to remain to be cool versus that patient who is hypothyroid who's going to be so cold and you're going to want to give them warm blankets. That kind of thing would come under basic care and comfort. All right, pharmacological therapies for the PN. So those are your PO meds, medication everywhere here, right? Lots of medication administration. Whereas the titration and venous devices and blood administration and TPN and all of that would also be included with the RN's pharmacological and parenteral therapies. All right, we're all going to be looking at reduction of risk potential, okay, and that's about responding, okay, to an emerging crisis, okay, or heading it off before it becomes a crisis because you have analyzed the data to figure out what's going on. You're heading off a problem, reduction of risk potential. So there could be a risk coming to the client. Maybe they're deoxygenating fast and you have a way where you can apply the oxygen via nasal cannula and restabilize the patient. All right. So it's about responding, intervening, and maintaining homeostasis and not letting them trend out to an attack or any kind of other exacerbation that you do not want for your client under your care. All right. And then finally, physiological adaptation. All right. These are the patients who have the trachs and they're on hemodialysis or they have an ileostomy. These are the folks who have perfusion issues and they're postoperative patients. These are our sickest patients who tend to have invasive procedures happening. Maybe they're on telemetry. Maybe they have their hemodynamics being monitored because they had some kind of placental abruption. Something bad happened. Okay, it's beyond reducing the risk. Something happened. Okay, maybe they're post-surgical and they require you to really focus in on the issues that they may have coming up because you don't want them to decompensate. You don't want that patient to go into a worsened state. Okay, so it's really about your highest acuity patients. All right, so I told you I was going to show you the candidate report. This is the one for the RN. I think I have one for the PN, but honestly, we know the difference now, right? We know that the two main differences, because otherwise these candidate reports are the same. We know that pharmacological and parenteral therapies and management of care, those are the only two different subcategories on the NCLEX in terms of the content areas. Okay, so for the PN, it's going to be coordination of care and no parenteral to be included there. All right. But notice that on the candidate report, okay, all they're doing here is listing in that little list of, let me see if I can zoom in a little bit closer here so that you can see that they're just reminding you of the parts of the test, right? And then look, they tell you 17 to 23% of the test was management of care questions. Well, that's not telling you exactly how many management of care questions you had did it. That's no different from what's in the very test plan that describes to you how the test is specified or how the test breaks down. Notice also that they're just repeating to you what the content is based on the table of contents that I just showed you earlier when I was showing you the test plan. So these candidate reports are not very helpful. They're not even telling you what you specifically did wrong. That's what keeps this test such a challenging test, because we don't get a lot of information when the test is over about exactly how we messed up. We just get another opportunity within 30, 45 days to take that test again and try it again. You will never see the same questions again, all right? Once you've seen questions from the NCLEX pool, and here's a secret, there are only 5,000 questions in the NCLEX pool at one time. They will remove questions and add more questions to the NCLEX pool according to, I think it's every 3 to 5 years, they will turn over 5% of the questions. All right. In other words, they get rid of outdated things that aren't as relevant anymore, and they start infusing in new concepts that might be, state of the art or the latest in nursing technology or nursing care. All right. So for that matter, they're not telling you a lot with this. They're just telling you where you were near the passing standard, where you were absolutely below, and where you were above. Sometimes they'll even tell you that you were above. Oh my goodness, the worst I've seen had above the passing standard in so many areas, and they were below in only like one area. And so they, the truth is that when you don't pass the NCLEX, often you're not passing it by only 2 or 3 questions, because the algorithm is so sensitive, and it knows that when you hit that mark, the desired testing logic mark that I mentioned before, whether it's 51% or not, or 60%, when you hit that mark, the computer just shuts off. It means you've met the minimum. You get to be above the passing standard and move on. Okay, so there's a passing standard. You want to kind of know what it is, so that when you are going to learn, that you are not crushing yourself feeling like you have to know 100% of the material. And it teaches you how to kind of just keep moving and trying to learn as much as you can as possible, so that when it's your turn to get on there, you can show the algorithm, I know 60% of this one category, safety and infection control, for sure. Okay. They don't even really care if you know much more than that. All right. You just have to be at the passing standard, or be above, but you can be slightly above and pass. Okay. So I hope that helps with thinking about how hard you have to study versus how wide you have to study. You have to study many, many concepts, and you have to get them at about 60%. Okay, that's why I say, for that reason, when you're doing practice questions, what do I want you to get on your practice question sets? Try to get above 60%. Stay above 60%. I don't care if you just had 5 practice questions, or if you had a whole practice question set of 50 or 150 questions that you did in one sitting. If you can get a 60% or better, you're still on your way to being able to pass the NCLEX. Okay. Ideally, I would love for you to hang out in the 70% range, because you've got nice cushion there, and that you've got a little wiggle room in case the questions you get are a little on the harder side. All right. But guess what? The more hard questions you can complete, the faster you get to finish your test. All right. Because if you get lots of difficult questions because you're answering these difficult questions correct in a row, you can pass the test sooner. with fewer questions, right? Because you got all your hard questions out of the way. And the NCLEX algorithm has a way of knowing, well, this person answered 70 questions, 70 tough questions correctly, they get to pass, versus someone who answered a mix of tough and easier questions correctly. They also get to pass, right? But it'll just take them a little bit longer into the test. All right. Okay, so that's how the report works. We've talked about the test plan. Oh, there's my PN version where you have coordinated care and pharmacological therapies. All right, and the goal is to be above the passing standard on each category. I hope I've driven home that idea, that point for you, because that's what this thing is all about. It's not about perfection. It's not about going through every single thing you ever learned in nursing school. It's about knowing the topics you're likely to see and scoring 60% or better. And as I mentioned before, because there are 5,000 questions in the pool, they're already a set topics that you're going to likely see, right? And if we know this is a certification safety exam, then we already know that there's going to be a specific type of question that you see. All right. So you've just eliminated a lot of extra studying that you don't have to do in case you were outside of what they're looking for on this test. All right. So now is where I'm going to go through some reasons why people are not successful on the NCLEX, so it can help you think about how you might study, because right after that, we're going to go into how I think you should be studying. Okay, so I'm going to fly through these because, again, I've pre-recorded this information and I don't want to spend too much time on what you can take the deeper dive on earlier. I just want to show you how to use the material so you can get yourself underway with studying. All right, so are you overwhelmed by having too many study materials? Do you find yourself comparing yourself to other people? Oh, I took my nursing classes with her and she wasn't even the brightest person in the class, and she went and passed her NCLEX before I did. Some people say that and they get so frustrated because they don't get the rhyme or reason to the test. They might feel like, oh, well, that person must have got an easier version of the test than I did. Maybe they did. Okay. Or maybe they did not overthink the way some of us can when we get down to take that test. And they were just straightforward demonstrating to the algorithm that they knew 60% of what kind of questions they were getting. Okay. So don't compare yourself. Everybody's taking a different test. That's why it's not fair to compare yourself. You never know which questions you're going to get initially. And those initial questions that you get set you up for an entire test. And can you get to a terrible group of questions that are just so against what you know? Yes, absolutely. Sometimes it's not even your fault. It's the type of questions you were getting. So that's why the last thing I do in my coaching, especially as you near closer to the test date and we start getting nervous, I am always sending out prayers to the universe that you will get good questions, right? That you will get a good batch of questions that you feel comfortable with so that you can show confidence and move through the algorithm and do what you're there to do. Okay. So don't ever compare yourself to others. Everybody gets a different test. Excuses are what I call like those things you can't take back when you go later and you take the test and you realize, oh my goodness, if I had studied just a little bit longer, or if I studied just a little bit more on that one concept, or if I really focused on getting those 60% or better instead of allowing myself to get 51% and thinking that I was okay with that. All right. Those are all excuses when you don't pass. All right. So you want to eliminate those before they even happen and put your best foot forward when studying and give it all you got. All right, your study approach. Maybe you're using the wrong approach. Maybe notes are not for you, Benta, as what we were thinking about before. Maybe you would work better looking at the Lippincott Fast Facts is what I'm thinking for you, Benta. So keep that in mind. I'm going to talk about it again in a little bit. I think the Fast Facts will work really well for you, especially because, it's hard to know sometimes exactly which notes to even grab is the most important, and that's not your fault. Some people are not just big on notes. But that said, study approach may just not match perfectly. So we'll try to align you with a match with your study approach. Knowing versus memorizing, this is super important. It's not enough for you to memorize, although you will have to certainly do some memorizing. All right. It's not enough for you to just think that you know everything, because as I just mentioned before, you only have to know 61% to pass. All right, let's say 62%, right? You have to just be above the passing level by just a little bit. All right, so you have to know, and you may have to do a little memorization, whatever you have to do. There are concepts you're being tested on for this certification exam that you'll never have to worry about again. For example, if you don't want to be an OB nurse, don't get mad that you will have to learn the birthing process for this test. Okay, I have an easy way for you to learn it, and I definitely hope that some of the things I focus on with OB will help you with knowing which of those principles you really have to know for the NCLEX, so that you know some things and you memorize some things, and together you put together enough to pass this test. Test fatigue, that means that you were not doing enough practice questions so that when it was test game time, right, the test day, you were tired. You hadn't done enough like building up your stamina. So you became fatigued when you got a little nervous, or maybe you got a little hungry. It's a 5-hour test. So if you don't have the stamina to get through that first hour, take a break, go sit down, look away from the screen for a minute, and then come back and reapproach that test with the same type of confidence. You'll get worn out. Okay, you'll have a panic attack. You'll get the glazed over look in your face. There's so many things that can happen just when your body chemistry does not work well with the way you've prepared. Okay, so we want to get kind of relaxed with everything. We want to get ourselves to where we understand that we're going to pace ourselves through this test. And then we have test date pressures. Maybe you set the date already, so you're feeling like you have to meet that date. And so you keep going, you don't adjust your study technique. You are nervous because of this date. And then you go in the test and then you don't pass again, right? Because you let the test date pressure you instead of knowing that you can always push that date back by 2 weeks if you're like, I need another 2 weeks to really put time in to these topics that I have not quite gotten yet. How do you know when you need more test time? Because you're still taking your practice questions and scoring underneath your goal or your target percentage. All right. Maybe it's 61% for some, it's 70% for others. It all depends on where you want to push yourself, how much cushion you want to have going into the NCLEX. All right. Maybe you're working with a certain type of NCLEX preparation material where a 65% in that material gets you passing the NCLEX Archer review. Or in another type of NCLEX prep resource like UWorld, you need like 80% to feel comfortable that you are all set and ready for the NCLEX, okay? But you don't know that until you've been studying for a while, and then you realize I only have a week left to the NCLEX. And I'm just figuring out how I want to be studying, where my scores are just starting to tick up. Maybe you add another week. Not a big deal. Maybe you want to be solidly scoring in the 70% before you go to take that test, because your confidence will be there when you go in. All right. So don't ever let the test date, especially if you live in an area where you can simply reschedule, be the reason that you didn't use another week or 2 to get yourself together. Okay. So those are just some of the main reasons people aren't successful with the NCLEX. I like to go over them so that you can just shed yourself of the worry that you can have about the way things went the last time, if you took it already, and if you didn't take it, some of the things you hear, just knowing that, hey, I'm going to do it all right the first time so that I don't have to stress myself out about it and have regrets on the back end. It's perfectly fine. And that's why I show that list to you, because, I want us to lighten up a little bit, relax, and kind of lean into the process.